Actress Jada Pinkett Smith brought attention to it after the Oscars incident. She's one of roughly 300,000 Americans who were diagnosed with alopecia every year. But now there's hope for the debilitating hair loss.
Dr. Leona Anifowosi, chief trichologist at the Texas Hair Restoration and Wellness Center, joins us now live to talk about the new FDA-approved treatment for alopecia. Good morning and thank you for joining us. Talk to us about this breakthrough alopecia treatment. What does this mean for patients now?
Good morning, Jose. It's good news for patients. It's the first FDA-approved drug for alopecia. So it's really good for people, especially people with alopecia areata. Let me correct that. There are different types of alopecia, but the type that Jada had, alopecia areata, it's autoimmune, so this particular drug, baricitinib, has been proven very effective.
And so we're taking a look at some of the bottles and the boxes of it. It's actually a pill. It's not any type of cream that you would put on the scalp?
No, it's just a pill a day, one pill a day.
Now, what kind of results can people really expect? And is there a particular time frame? You take it and 1 week later, hair starts regrowing or what?
Well, hair never usually grows in 1 week, but I believe with this drug, it can begin growing from the very first peel, but there is going to be a period of time, and most people with hair loss are used to waiting a period of time, but the clinical trials seem to show that 33% of the people who were given high doses were able to recover over 80% of their hair, which is tremendous with that type of alopecia.
Wow, it certainly sounds promising for a lot of people. What happens if they stop taking it? Once you get your hair exactly where you want it, can you stop taking it, or would you lose the hair once you stop the pill?
Well, since it's an autoimmune disorder, it's hard to tell, but I would think that because of the way it regulates the body, it deals with more of the pathway, which causes inflammation. So I think once the inflammation has been reduced, and if a person's on the proper diet, then they should be able to maintain the hair restoration. But diet would be an important part of it because we all know certain foods can trigger inflammation in the body.
Talk to us about the availability it is for the average patient.
Well, the good news is once a drug is FDA approved, doctors feel much more comfortable, ordering the product for the patient. So I think it's really readily available. They would just have to ask their doctors. It's FDA approved. They can now write the prescription. It was formerly used for arthritis and other autoimmune disorders. So doctors already had access to it, but these new studies has proven it incredibly effective in work with alopecia. So it's readily available.
And I'm just wondering, I have talked to a number of people who have suffered hair loss from COVID. Could that help them as well, or does it have to just be this particular condition you're talking about?
Well, that depends, because in fact, this particular drug, baricitinib, was used to treat COVID patients in the hospital. So I'm unsure if once they are released or they don't have COVID, that a doctor would just arbitrarily give it to them because they once had it, but it was actually used to treat people who had respiratory problems on COVID, so I don't see why not. But you would again use high doses, so with it being a drug, that would be an independent decision.
Well, it's great for those patients who are suffering from alopecia. Thank you, Dr. Leona Anifowosi from the Texas Hair Restoration and Wellness Center.